My name is Pro Mukherjee, and I work in the emergency department at the Leicester Royal Infirmary. Today we're going to talk a little bit about how we can use the SBAR communication tool in emergency department communications. The SBAR stands for S is for situation, B is for background, A is for assessment, and R is for recommendations. And it's a tool that was first used in the US Navy, but has been adapted for communication and handover across the NHS. So in this short video, we're going to talk about how we can use it in our emergency department. Easiest way to remember what we need to cover in situation or S is the mnemonic www.why. The first W is for who you are, the person speaking, where you are speaking from, who you are speaking about, the patient, and why you are communicating to the person you are. The background is to help the listener get a kind of mental image of the patient, what the patient's age, gender, presenting problem, and key medical history are. A is for assessment, and in the emergency department it's also for the actions you've taken. So your assessment will be your working diagnosis, your problem list, and any treatments you've done so far. Coming on to R for recommendations. Generally, they will be to either review the patient, admit the patient to a particular specialty, or to discharge the patient. You'll usually include a time frame, whether this needs to be done urgently or immediately, and any other things that are left to do, follow-up investigations, any other medications, any specialty referrals. Finally, you'd also want to check whether the person you're speaking to has any questions or any recommendations of their own. Well, for the next section, we're going to discuss the SBAR in a little bit more detail. So we said situation was for www.why. When you're starting with who you are, it's helpful to give your name and your designation. I'm Ben, the emergency department nurse, or I'm Paul, healthcare assistant, Sumaya, the senior house officer. It's helpful to tell them who you are and your role. Where you are is helpful as well. Which area of the emergency department? Is it the resuscitation room, the assessment bay, the majors area, the minors area, or the children's area? Who you are calling about, the third W, the patient's name, and if appropriate, the patient's hospital number. Finally, why you are calling and the specific purpose you have for making this communication or this phone call. The next section is background. And here what you are trying to do is you help the listener develop a kind of mental image of the patient who is in front of you. So the patient's age, gender, presenting problem, and key medical history. For example, Mrs. Pi is a 72-year-old lady who is normally in good health, apart from high blood pressure and raised cholesterol, for which she is on medication. She was coming out of the bathroom this morning when she tripped and fell and injured her left ankle. Her early warning score currently is 0. On assessment, she has broken her left ankle, but has no other injuries. Review of her cardiovascular, neurological, respiratory systems and GI systems were all normal. We've done a full blood count on Mrs. Pi, as well as urine dipstick, urea and electrolytes, and an ECG. All of these were normal. An X-ray of Mrs. Pi's left ankle does confirm a fractured lateral malleolus. Moving on to the next section, assessment. Here we are making a list of our working diagnosis, the problems we've discovered so far, and the actions we've taken. So going back to our previous example, my assessment of Mrs. Pi is that she has fractured her left ankle. However, I am concerned there may be a medical cause for her fall. The steps I've taken so far include I've given her intravenous morphine and paracetamol for the pain, and her ankle is now in a below-knee back slab. I've requested a chest x-ray and cardiac enzymes to help work up the cause of her fall. Moving on to the next section, my recommendations. My recommendations are this patient be admitted under the care of the medical team so that the cause of her fall may be investigated, but she will require orthopedic input to manage her fractured ankle. Do you have any questions?